Hi, my name is Randy Beckett, and I am a psychiatric nurse practitioner. My special area is in geriatric psychiatry, and I live in Mount Pleasant, South Carolina. I work with Encounter Telehealth out of Omaha, Nebraska. And at Encounter Telehealth, we provide telepsychiatric services to residents of nursing homes across the Midwest and Western United States. So I wanted to explain to you a little bit about how telepsychiatry works, but first let's imagine what would happen for a regular visit for a resident of a nursing home who is going to see a psychiatric provider. Well, first of all, the person, your loved one perhaps, or your resident or your patient, because we're talking to a variety of people today, would have to get dressed. Arrangements would have to be made at the facility, at the clinic where they may be attending. A staff member would have to accompany them. They would have to get in a vehicle and be driven perhaps 20, 30 miles from rural areas to a clinic where they would have to get out, go into a office and wait until they get to see the psychiatric provider. This can be very troublesome for many patients, especially those with dementia, because this can be very disconcerting to them. The change of atmosphere, the overstimulation of a clinic office, new people, noise, the inconvenience of having to do all of these things. Or for people who have mobility problems, all of these things make it difficult for these residents. The problem with this also is that when going to an outside clinic, a nurse or a member of the nursing staff may not be with the patient in the exam room to help describe what's going on with the resident and the way they're taking their medications, if they're having problems taking their medications. So this is overall very inconvenient. And there's a huge shortage in rural America of psychiatric providers. And also, many times if you can find a provider, the question is, do they take Medicare and how long will it take to be seen as a new patient? Sometimes months. So with Encounter Telehealth, we provide telepsychiatry services to residents of nursing homes. And this is how this works. An appointment is made, or perhaps a physician, a nurse practitioner, or a physician assistant who is taking care of the resident as a primary care provider suggest that the resident be seen for a psychiatric evaluation. Or perhaps the family would like the patient or the resident to be seen, or the facility would, the nursing staff. And so they call our office, paperwork is signed and forwarded to the office, and an appointment is made. And it can be done urgently if necessary. Or sometimes it can be in a week or two, whichever is best for the resident. Then, the day of the visit, the family may accompany the resident to the room, which is a quiet, secure room that's private, where our computer is, and where a nursing staff member or social service person or other person on the staff will accompany the resident. We'll go over all of the resident's medications, go over the problems they've been having, if any, what kind of mood they've been in, if there's any problems taking their medication, and all of the things that are important to the resident. And all this is done with just a simple walk by the resident or in a wheelchair or with their walker inside the facility to a room which they may have been in before, but at least they're going to be in a familiar surroundings with familiar people. And then we interview over secure televideo the resident. So they can see me large on the screen and I can see them. I have their medical record in front of me. And we review all of their medications, review what kind of problems they're having, their drug allergies, just like you would in a normal face-to-face visit. And then if necessary, we can do psychotherapy. We also do complete medication management to help with depression, anxiety, a variety of mental health problems, including dementia. And the good thing about this is that the family can be, or loved ones, or whoever is important for the resident can be in the visit with them. Also, some family members like to listen in on speakerphone. And as well, we can give our software app to a family member, and we've had family members join us on a joint conference call with their loved one and the nursing staff and with our providers. They may be 2 or 3 states away, and they still can participate in the visit on the computer. So this is much better in many ways, that we get more information about the resident. It's less stressful on the resident. It's not as invigorating or as stimulating, which is a problem with people with dementia. And we right away do the progress note and send the prescriptions electronically to the pharmacy. And then as soon as the visit is done, within minutes or perhaps an hour or less, the note that we just did on the resident or your family member or patient or resident in your facility is faxed to you directly, and it gets there immediately. And then also, if the staff would have other issues, they can call the office and they will get a hold of the provider, and the provider will respond very quickly to address any concerns there might be. We love collaborating with primary care providers to make sure that we're all on the same page in coordinating care for the resident, and making sure that they know that they can call us with any concerns, or we can call them. And also the family knows that they can contact us with any of their concerns as well. So this is growing very rapidly because it's filling a huge need. And people often will say, well, how does a 90-year-old understand with dementia talking to somebody on a computer? And it's wonderful, but it just works. They're used to seeing television, and they just relate to those of us who are talking to them on the computer. Now, a few people who have maybe severe dementia don't understand, but still we're able to provide them with care that they badly need without them having to be disturbed. So it's a wonderful service. It's Encounter Telehealth. We're out of Omaha, Nebraska. And I encourage you to contact us and contact the office with any questions, and we'll be happy to help you in any way we can. We look forward to taking care of your residents, your loved ones, your family members, or if you're a provider, your patients. Thank you very much.